let's look into another condition, DeQuervain disease. What is DeQuervain disease? It's a tenosynovial inflammation of the first extensor compartment, which encases tendons abductor pollicis longus and extensor pollicis brevis. It's common in females between the age group of 40 to 50, and it's common in people who play racket sports. So what is the etiology of developing DeQuervain disease? Why people develop? In most of the cases, it's idiopathic. In some patients, there may be a history of playing racket sports. For example, it's called overuse syndrome. In some cases, it may be following trauma, or rarely in postpartum female patients. So if you look into the anatomy, in the wrist, on the dorsal aspect, there are 6 extensor compartments. The first compartment encases abductor pollicis longus and extensor pollicis brevis, and this is the compartment which is affected in DeQuervain disease. So what are the clinical features of DeQuervain disease? It's common in females between the age group of 40 to 50. Patients report often pain on the radial aspect of the wrist, aggravated by movements which provoke repeated wrist movements. So if we look into the examination finding, when you examine, the wrist may appear normal to look at, but when you start palpating, there may be tenderness in the radial aspect of the wrist, around the radial styloid area. There may be thickening of the tendon sheath, and there are 2 tests which are diagnostic value in DeQuervain disease. One is Finkelstein's test, and another one is a hitchhiker's sign. In Finkelstein's test, it's basically making a fist with the thumb including in the fingers, and extreme ulnar deviation will reproduce pain. And in the second part, actually it has a second part. In the second part of the test, you exclude the thumb in the making a fist, and once again, ulnar deviation will not cause the amount of pain it caused when while doing in the first part of the test. So that shows that the first compartment is affected in DeQuervain disease. And the other test, which is hitchhiker's test, is resisted extension of the thumb will reproduce pain on the radial aspect of the wrist. So what are the investigations which are useful in DeQuervain disease? The radiographs are often normal, so we generally don't request for radiographs, but certainly radiographs may be helpful in differentiating other pathologies. So there are certain differential diagnoses which you need to rule out. For example, arthritis at the base of the thumb, CMCG arthritis, scaphoid non-union, which is visible once again if you take an X-ray. There may be scaphoid non-union which may be visible. In those cases, there will be history of trauma as well. And the other diagnosis which we need to rule out is the intersection syndrome, where the pain is slightly located proximal to the radial styloid. So let's look into the treatment of DeQuervain disease. In majority of the cases, non-operative treatment is the mainstay treatment modality. So the conservative measures involve rest, anti-inflammatory medication, physiotherapy, and ultrasound guided injection. Physiotherapy just to stretch the tendons, and ultrasound guided injection will involve injecting steroid into the first extensor compartment. In failed conservative measures patients, rarely operative intervention is required. That will involve release of the first extensor compartment. So operative treatment is not out with complications, and the complications of operative treatment include damage to the dorsal sensory branch of the radial nerve, and sometimes the neuroma may form. if we fail to release adequately, there is a possibility of recurrence of symptoms. Rarely, complex regional pain syndrome can develop following surgery. So, to conclude, in summary, DeQuervain disease is thickening and stenosing synovial inflammation of the covering of the first extensor compartment, which encases abductor pollicis longus and extensor pollicis brevis tendon. It's common in females between the age group of, say, 30 to 50. It's common in people who use racket sports. Pain is mainly located on the radial aspect of the wrist with positive Finkelstein's test and Hitchhiker's sign. Radiographs are often normal. Non-operative treatment is a mainstay treatment which involves rest, anti-inflammatory medication, thumb splint, physiotherapy, ultrasound guided injection, etc. And rarely operative treatment which involves release of the first extensor compartment. And this concludes the overall view of DeQuervain disease.